So as gastroenterologists, we see some patients who may, aside from colon cancer screening, may see us once because they have a particular issue. They developed an ulcer and had a gastrointestinal bleed, or they had some other bleeding process or infectious or inflammatory process in the gastrointestinal tract that may not be a chronic condition and may be treatable, resolve, and not recur. But many of the things that we treat as gastroenterologists are chronic conditions. So gastroesophageal reflux disease or acid reflux disease is one of the most common chronic conditions in the United States in general, and as gastroenterologists, one of the most common things that we see. And those patients do tend to be patients that we follow regularly. Patients who have chronic inflammatory bowel disease like Crohn's disease or ulcerative colitis certainly get to know their gastroenterologist very well, because it is a chronic condition that requires the use of chronic medications and lifestyle and diet modifications that we need to follow with the patient for. So again, many of those conditions are things that we see patients for regularly. In addition, for colon cancer screening, many of our patients are going to have precancerous polyps. So statistically, we're going to see precancerous polyps in at least 25 to 35% or sometimes higher of our patients. And so those patients are going to have colonoscopy more often than every 10 years. They may have colonoscopy every 3 to 5 years, depending on the size and number of their precancerous polyps. So to some extent, even patients who are just coming for routine screening and surveillance follow-up, they become regular patients as well because we see them more often.